objective assessment of sickness in neonates using sonography. So today's lesson is how to perform lumbar puncture using bedside ultrasound. The lumbar puncture is done routinely in newborn intensive care unit to rule out meningitis, and usually the needle is inserted, and the needle what we use irrespective of gestation age use the same needle, and we don't know the depth of the needle. We just go with the give-away sensation and see to that the lumbar, the spinal fluid will come. But most of the times actually the failures will happen or the traumatic samples will happen. To avoid that and also to know the exact depth of the spinal canal, we use bedside ultrasound. So today's lesson is how we do bedside ultrasound, how to get the anterior spinal canal length, posterior spinal canal length, and the mid spinal canal depth. And we have a formula also. We use the formula and make sure that whether the formula fits in this baby or not. Okay, and there are different positions we use for lumbar puncture. Commonly used is either left lateral position or right lateral position. Sometimes we use prone position and also the sitting positions. And we document the spinal canal depth in all the three positions before performing the ultrasound, the lumbar puncture. What we are doing, this is the posterior aspect where the needle will be inserted. Okay, and from the point of the skin till you get, this is the bone exactly, isn't it? And from here to first bone, what you see, that is your posterior spinal canal depth. Then from skin till the end of that bone will become anterior spinal canal depth. Okay. Then what you see the area here is your spinal canal depth. To get the mid spinal canal depth, we take the half of this spinal canal depth, we add to that posterior spinal canal depth. Are you clear? So now this is the formula we use. What is the formula again? Mid spinal canal depth is equated to half of the spinal canal depth plus posterior spinal canal depth. Okay, let us see that one. In this coronal plane, you have to identify the anterior superior iliac spine, and you follow that just above that anterior superior spine. And yeah, now you can see that. Now you can beautifully can see. Okay, now I'll freeze it. What I'll do is I'll take the caliper from the skin. This is from the skin till this point is what. Okay, you have taken here. Correct. So this is the anterior spinal canal. Okay, depth. Now what I'll do is I'll take the caliper. I'll go there. From there till this point. Correct. This is the posterior spinal canal depth. I'll take another caliper from here. This point. Correct. Yes. That is your spinal canal. Now the ultrasound spine is being done while baby is in sitting position, and then you can see the image there. Okay, yes, baby. And then I take another one from here till here. Then I take another one from here till here. Okay, yes. That is your spinal canal depth, thickness. So we have got, there is posterior spinal canal depth, anterior spinal canal depth, and spinal canal thickness. So all the three values we have. Spine on prone position, and you can see the image there. So you can see the image there. Okay, I'll take the now again I'll calculate spinal canal thickness, posterior spinal canal depth, anterior spinal canal depth. So using these three, we can calculate the mid spinal canal depth. That is nothing but half of the spinal canal thickness plus posterior spinal canal depth. All right. Now this is just to make sure that in all the positions whether it is equal or not. Understood? Now let us do the lumbar puncture taking all the aseptic precautions. By using this formula, we got the needle insertion depth should be around 1.1. Okay? This is the formula we used. Mid spinal canal depth is equated to posterior spinal canal depth half of spinal canal thickness. So this is all. So this is very useful. If we know how much depth we have to go, it's easy to enter, and you can also customize the needle for the given gestation. Here we are dealing with a 40 weeks gestation baby, 4 kilos baby. So for 4 kilos baby, the needle length should be around 1.1. So let us see what exactly practically we can get out of it. Now Dr. Nirmal is performing lumbar puncture. The baby is laying down prone position and completely vital parameters are being monitored. They are perfect. Now the needle is being inserted and
That giveaway has come.
yeah. Now exactly he has gone to around 1.1 centimeter depth. You can see the fluid is coming up. Fluid is coming up. See how beautifully it is coming up. Now he is aspirating and all the sterile precautions have been taken, and see, this doesn't require much work both for the doctor and the nurse. Nurse is comfortably holding the baby and see how beautiful, and it is a clear fluid, and even you see the force it is coming. Otherwise sometimes you may miss the needle while routinely when we do, we put the baby in left lateral or right lateral position. Sometimes chances of needle being moving this side, that side, but you see how static it is, very static. Okay, so I think one shot you could get the and there's no trauma. You can see that there is a clear fluid, and you could go one shot and get the fluid, and you can see that. So well done, Dr. Nirmal. So how do you feel, Dr. Nirmal,
It's a
doing
very
lumbar puncture on prone position?
it's relatively very easier procedure as compared to the conventional side posture we are doing lateral positions. So
Yeah,
it's easier for the baby
yeah,
and it's easier for the doctor as well.
yeah, very nice. And this is the second time you are doing lumbar puncture on prone
And the
position.
concern for flow, which you think is also
Yeah,
not there because it comes very nicely.
great, great, very nice. So this is the second time you are doing lumbar puncture prone position successfully. Very easy to do, very and very comfortable to all the three people here, the baby, the nurse, and the doctor. Thank you so much.